Knock, knock, knock. Hi, Mr. Campbell. My name's Elizabeth. I'm going to be your nurse today. Can you please tell me your name and date of birth? All right, thank you. And then provide patient privacy. All right, so today I've noticed you've had some issues with your urination. So what we're going to do is we're going to put in a urinary catheter into you. That's just a little tube, and it's going to go straight into your bladder. And it'll help you be able to urinate. And then you will feel a little bit of a pressure when we were putting it in you, but once it's in you, you shouldn't feel any pain at all. All right, so now we're going to raise the bed. All right, and then we're going to put the side rail down. And then we're going to just expose the area that we need to work with. And then we're going to put your legs in the dorsal recumbent position. Alright, awesome. And then if there weren't an incontinent pad there, I'd put it under him, but he already has one under, so we're good. Alright, and then I'm going to go and I'm going to put on some clean gloves. And then we're going to clean your perineal area. Alright, so then I would take a washcloth and I would dip it into a little basin that's filled with water and soap. So I would dip it in, and then first I would clean like the inner part from inner to outer. Do that. Then I would go flip the washcloth to the other side, and I would dip it in the water again. Then I would clean like the outer, and then I would flip it again one last time, dip it in the water, and then do the outer end. Then I would go and put the wet washcloth in the laundry bag, and I would go and grab a new dry washcloth, and then I would dry everything off. And then I would put this again in the laundry bag. And then I would take off my gloves and perform hand hygiene. And then let's get your leg set back up before we start. All right, perfect. So then I would go and grab my catheter kit. All right, let's take this out. All right, let's fix your leg again. All right, and then let's fix your other leg real fast. All right, perfect. Alright, so then, let's just set this set up. I'm going to open it on the side opposite of me. Alright, and then I'm going to go and grab my sterile gloves and put them on. Alright, perfect. And then we're going to come back over here. And then this is a water drape. So what we're going to do is we're going to put underneath you. That way if any water squirts out, it just goes under here. And then the shiny side is going to go on the opposite side. Flip this like that, and then we're going to put it right underneath your legs. Perfect. And then we're going to put this to the edge of the bed because we don't need it. And then we're going to set this up like that. Alright, and then we don't need this, and we don't need this. So then I would open the lube for the catheter tip. I would open it, squirt it in there, and then I'm gonna grab this. I'm gonna take the packaging out.
We can talk for like 4 minutes.
Alright, awesome. And then we're just gonna go and we're gonna dip that in the glue. And then we're going to take the syringe. We're going to take the cap off of it, and then we're going to put it into the port of the catheter. Good. So then we're going to just get this all situated and ready to go. Alright, awesome. And then now what we're going to do is we're going to clean the area once more with some cotton balls and iodine before we actually insert the catheter. So I'm going to hold it with my non-dominant hand, and once I touch it, I can't break it. It's sterile, so I can't move it. And then I would take the cotton dolls, dip it in the iodine, and then I would clean the inside. I would throw it out, get a new one, do it again. Do the same thing with that one, throw it out, do it again. And the third one, I would do the same thing, throw it out, do it again. Then I would throw that away. And then I have my tube, so then I would start inserting the catheter into the bladder, and then it'll go in 7 to 9 inches until I see urine, and then once I see it, I would put in another 2 inches.
And then I was saying that we can kind of like talk about ethnicity with demographics, right? Does that make sense? So just delete that slide.
Alright, and then it's good to go. So then I'm going to take it and I'm going to put about 10 milliliters of saline into the catheter.
You just gonna choose whatever.
Alright, awesome. Then we're going to unhook this. We're going to put it in here. And then we're going to tug and make sure that it's securely in, which it is. So now we're going to hook it onto your leg. So we're going to hook this blue part onto your inner thigh. And then now we're done, so I can move this hand. And then we're going to move this, and we're going to hook it onto the side of the bed. Make sure it's not the side rail, the actual frame of the bed. Alright, awesome. And then we're going to clean up the whole area. And then I would throw this all away in the trash can. And I would take off my gloves and I would perform hand hygiene. Then I would go put your legs back down, and then I'd cover it back up. And then I would go put the side rail up, and I'm going to lower the bed back down to its normal position. Alright, and then your collet is right here, so if you need anything or if you start to feel any pain in the catheter, please press it and I'll come back to help you.